Now, this is a CT scan of the abdomen plus pelvis we can see. And today I'll be showing some interesting thing of this CT scan. Now, you must know this is CT scan of the abdomen because this is liver, this is spleen. It's very easy to understand the liver and spleen because liver will be present on the right side and spleen will be on the left. Now we must know that both liver, this is the liver, and spleen has same attenuation or same radio density. You can see this, the texture, the radio density of the liver is almost same or same as spleen. Just in front of spleen, because spleen is present on left side of the body. We can see stomach because stomach is also present on left side of the body. And we can always identify gut or intestine or stomach by two to three things. First is gas, because gut always have some food and food is digested and after digestion gas is created. Apart from that, it can always have some part of food, means it is not mandatory, but most of the time there is some food, some feces, some food that is present in the gastrointestinal tract. So presence of gas, food usually suggests it is intestinal system. So here, this is all gas. We can always know the gas or air is the most dark black. This is the dark black, and this is the same as this. So this is jet black or dark black. This is air. So in this, the air is there. This is air fluid level. It means ki there is some food or there is some liquid inside. This is contrast. This is hyper dense thing. There is dense white is all contrast. This is oral contrast that the patient has received. You can see this is also intestinal coils. You can see here this is air, this is air. Here also you can see this is all contrast, this is oral contrast, and this is air which is black. This is all air. So this all is air and this is all contrast. So this is spleen and this is liver. Now apart from that, what we can see that when you want to come to know whether there is IV injected contrast is given or not, this is vertebra, and just in front of the vertebra, this round structure is aorta. So this is aorta, and this is the most circular thing. You can trace it here as well. You can trace it here as well. You can trace it here as well. This is aorta, and aorta is circular, and you can see dense white structure in that. This is contrast. This is basically IV contrast. So in this film, we can see oral contrast because this is in the gut system, intestinal symptom, the system, and we can see IV contrast as well. You can see this contrast in this hepatic arteries as well. You can see this. This is all IV contrast. This is all IV contrast that you can see. So on this basis, we can tell that this is an early phase of contrast. This is an arterial phase. Arterial phase, why? Because this contrast is still in the large vessel. As some time passes by, suppose a minute or two, this contrast will disappear from the aorta and then it will be visible in the pelvis of the kidney. But here, see, this is the aorta, this is aorta, and this is the renal artery. So this is right renal artery. This is left renal artery. So on this basis, we can see that we can trace the arteries on this CT imaging. This is the right renal artery. You can very nicely make out. So the most important thing which I wanted to tell in this is, if you can see, this is a beautiful CT image showing pancreatitis. Now, whenever you want to diagnose some pancreas issue, you must first find the pancreas. Now, how to find pancreas? If you want to find pancreas, you must know the anatomy. Pancreas tail touches spleen, so just find spleen. So this is spleen. This is spleen, and this, the part which is touching here, this is all pancreas. So this is all pancreas. because this is kidney, this is kidney. These kidneys you can trace in all the images. You can trace this here. This is kidney, this is kidney. So this is spleen, and this is pancreas because this is touching the spleen. Now, how do you come to know that this is inflamed pancreas or the pancreatitis is there? Now, the most important rule to call it as pancreatitis, there has to be some inflammation of pancreas. Now, how do you come to know that there is some inflammation? Whenever there is inflammation, there will be increased blood flow. Now, this pancreas is all surrounded by fat. Now, how to find out fat? Fat looks black on the CT scan. So, the most dark black thing on the CT scan is air. Air is the most dark. This is all air-like. So, this is most dark black. Next to this dark black is fat. Fat will be not as much dark as air, but this will be still black. So I'll show you the fat. Now fat, this is all obesity. This is all obesity. So this is all fat. This all is fat. The same way, this is all fat. This all is fat. So remember this black. This black is much lesser than this black. So this is the attenuation of the fat. And we also have so much fat in the abdomen as well. So this is all fat only. So this fat is very well localized. There is no any infiltration. You can simply say this is all fat, and this fat is very well localized, sharp. There is no any white lining in it, because whenever there is inflammation, there will be increased blood flow, and automatically some white streaks will appear. So here also there is very well differentiated black region. There are no white linings. Now compare the same thing here. Now we know that first thing, whenever there is inflammation of pancreas, the pancreas margins will become all blurry because of the inflammation. So we can very easily see that if there is no inflammation, the margins of any organ will be very, very well defined. Just see the margins of spleen, liver. It is so well defined. See the margins of spleen. It is so well defined. See the kidney. See here. The kidney is so well defined margins. Here also the kidney margin is so well defined. Here it is so well defined. But in here, this pancreas is all blurry. Is all blurry. Is all blurry because there is inflammation. That is the reason why there is increased blood flow. That is the reason why there is infiltration of the fat surrounding the pancreas, making everything blurry. So there is no necrosis. Otherwise, you can see the necrosis as a fluid level, or you can see multiple cystic lesions if there is necrosis like this. But in this, there is no any necrosis. So if you want to tell that it is pancreas, the pancreas should be enlarged in size. Its margins should be blurry, and the surrounding fat around pancreas should show infiltration, or what we call it as peri-pancreatic fat infiltration, which we can very nicely make out here. So see, this fat is very well defined, but here it is all blurry. The same is here. The margins are blurry and there is infiltration of fat. So this is, see here, it is so well that it is all blurry in here. So there is peri-pancreatic fat infiltration. One more thing which is very, very beautifully seen in this image is we can see actually main pancreatic duct. So in this image, the main pancreatic duct is dilated. You can see this is all pancreas, and in the middle of that, if we can see this margin, there is a black hypodense tube you can see. So if I can create an arrow, you can see this. You can see this. I'm pointing out there is one narrow tubular structure. This is all main pancreatic duct which is dilated. So there is dilatation of the main pancreatic duct. I'll draw this. So in short, this is here. This is main pancreatic duct which is dilated. So there is dilatation of the main pancreatic duct. There is pancreatitis, and dilatation of main pancreatic duct itself tells that there has to be some chronic inflammation. And currently, this is showing enlarged pancreas, blurry margins of the pancreas, and peripancreatic fatty infiltration, which suggests acute pancreatitis. So this is one of the excellent CT scan of the abdomen showing chronic on acute pancreatitis and other things which I just told you. So thanks for now.